This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Mentoplast Tablet is a medication used to manage myoclonus, a neurological condition that leads to involuntary muscle jerks. It contains piracetam, which enhances neurotransmission in the brain. Indications and uses. This medication is indicated for the management of myoclonus, a condition characterized by sudden, involuntary muscle jerks or spasms that can occur due to disturbances in the brain and nervous system. It is typically used in conjunction with other anti-myoclonic therapies to achieve better control over these involuntary movements. How it works. Mentoplast Tablet functions as a derivative of the neurotransmitter gamma-aminobutyric acid, GABA, improving the stability and fluidity of brain membranes, which helps restore neurotransmission. Directions for use. Take this medication exactly as advised by your physician. It should be swallowed whole with a glass of water. Do not crush or chew the tablets. The appropriate dosage and duration will be determined by your healthcare provider based on factors such as age, body weight, and specific medical condition. Always consult your doctor for guidance. Possible side effects. Common side effects may include restlessness, nervousness, and weight gain. If any of these symptoms worsen or if you experience uncommon side effects like depression or excessive sleepiness, consult your healthcare provider. Precautions and warnings. This medication is not recommended for use in individuals with severe kidney or liver issues, nor is it advisable during pregnancy or breastfeeding unless explicitly directed by a healthcare professional. It is also essential to avoid alcohol consumption while using this medication and to be cautious when driving or operating machinery due to potential drowsiness. FAQs. 1. What is Mentoplast Tablet used for? It is used in the management of myoclonus. 2. Can it be used in patients with kidney problems? No, it is not recommended for those with severe kidney issues. 3. Is it safe for pregnant women? It is not recommended unless advised by a doctor. 4. How does it work? It improves neurotransmission in the brain. 5. Can children use this medication? No, it is not recommended for those under 16 years of age. Thank you for watching. If you have any questions or suggestions, please feel free to leave a comment below. Your engagement is appreciated.